93.9 WLVB. Well, that sunshine looks good. Certainly enough to boost your spirits. We've had so much of the cloudy, wet stuff, but enjoyed the sunshine today. Maybe a little bit more later on in the week. Well, as you know, May is Mental Health Awareness Month, and over the last several years, we have been honored to collaborate with the folks at Lamoille County Mental Health Services to bring attention to Mental Health Awareness Month, and more specifically, many of these services that Lamoille County Mental Health Services here in Morrisville provides. And today we have Dr. David Mooney with us this morning. Nice to have you with you, David.
Thank you, Roland. It's nice to be here.
Thanks for coming in. Now, I was thinking, now last week when we ushered in the series, your executive director, Savvy Von Slyten, gave an overview of many of the programs that Lamoille County Mental Health Services provide, which is staggering, the amount of services you folks provide.
Yeah.
So this morning we're going to kind of narrow in a little bit about what your specialty is, which is psychiatric services. So
That's correct.
maybe just talk a little bit about what you do and the services that you provide.
Yeah. So yes, I'm a psychiatrist. I'm one of 3 psychiatric providers that we have. We have 2 psychiatric nurse practitioners, Julie Sullivan and Rebecca Brooklyn. So we're a 3-person team, and we provide all the psychiatric care for the agency. I think it's important to start with how you access our services, which of course are open to anyone. Should anyone want to access psychiatric services, the main number, 888-5026, is the number to call, and you would be connected with an intake clinician who would then do an intake. And that is typically about an hour process, sometimes an hour and a half. Put all that information together, then you're referred to a psychiatric provider. And at that point, a complete psychiatric assessment is done. Now, people kind of are a little bit skeptical about that. I know lots of the patients that I see are very anxious about coming in to see a psychiatrist, and I understand that.
Especially for the first time.
Especially, and I get that, and that's okay. But what I want to get out there is that a psychiatric evaluation isn't meant to be, an examination of your brain. It's a time to get to know you. And that's very important. And as we're getting to know you, we aren't focusing in just on medication. We're focusing in on your general lifestyle. We're trying to identify stressors that might have brought you there. Because everybody's different. Every case is unique. You can think at it, it's like every heart attack's different.
Right.
Knock on wood, your heart attack would be different than mine.
Yeah, exactly. And hopefully not having one at all, actually.
Right, yeah. But you know what I'm saying?
Right.
Everybody's different. And so we take it from that perspective. And also, it's important to know that the paradigm in psychiatry has really shifted over the years. We started out at the turn of the 20th century with Freud and Jung, and Adler came along, and there were all these psychoanalysts who kind of laid the framework for what psychiatry is today. But as we went along into the 50s and 60s, we started developing medication, the antidepressants, the antipsychotics, and those were very helpful during the time that people were being released from hospitals, state hospitals, and they provided tools for the treatment that people needed. Now, over the years, and they have been wonderful medications, and don't get me wrong, these have been lifesavers for many people. However, as we go along, we're starting to look at other things. And so when we're in that psychiatric evaluation, we're talking, like I said, we're talking about lifestyle changes and things that are going on with people, but we're also talking about, let's say you're coming in for depression. We're looking at depression as a symptom, not necessarily a disease, if you follow me.
Right.
Because if you are depressed, that is a symptom of a whole system gone awry. It doesn't just stop, it's not from the head up, from the neck up.
It's a progression.
It's a progression, and it's a sign that something has gone awry in your whole body. It's a systemic thing. So we try to approach it from that perspective, and I bring that up because I want to stress the importance of alternative approaches to that.
Right.
Vitamins, minerals, supplements, exercise.
Being proactive.
Yeah. Exercise, all different angles rather than just going for medication. I don't want people thinking that when they come into for a psychiatric evaluation, it's all about medication.
Right, and that the medication is the answer to all.
Right. Number one is getting to know them. So we want to have a relationship. So that's kind of how the psychiatric evaluation goes. If somebody needs, that's for non-urgent care. We also have a crisis team that sees people in the emergency room. We have the same crisis team, of course, answers phone calls. They do counseling. They do crisis intervention over the phone. It's a 24/7, 365 day of the year service. And frequently, people will come to the emergency in crisis, and they can be referred to psychiatry through that channel, too. We have time available in our schedules for seeing patients urgently. We have a crisis bed. We have a home here in Hyde Park with 2 crisis beds. So if somebody goes to the emergency room, let's say that in the old days, a lot of those cases would have just had to go to the hospital. We can do some acute crisis intervention at that time, get them into one of our crisis beds, and give them the care that they need in a less sort of hostile, if you will, environment. Strong word, but just a nicer way to get into treatment. So we have that. We also, in terms of psychiatry, we provide consultation for both our adult and children's services and the mobile crisis team, like I said. We have 3 residential facilities that we oversee and provide consultation to. One is the Copley House, which is an 18-bed facility with the patients there are more long-term, have been there for a while.
Right.
These are patients who, some of them may have been in the state hospital at one time or another, but now have a nice living situation there. We also have the Johnson Group Home, which is an 8-bed facility, which is kind of a step down to independent living in the community, and Oasis House, like I mentioned. The psychiatric team works in collaboration with the nurse manager, who oversees the community psychoeducation services, the CPS team. That is a wonderful program that we provide to patients in our CRT program, which stands for Community Rehabilitation Treatment. That's a wonderful program in that we can provide sometimes daily contact with patients who need medication management. Maybe they just have questions about their medication. Maybe we have a nutrition group that is provided by our nurse manager. So it's more, again, sort of it's not just medication. They provide the medication. If people need medications delivered, they'll provide that. But it's a very intensive and very effective program. And it allows us and them to have some eyes on, sometimes every day, maybe 2 or 3 times a week.
So, so in the closing moment here, before we have to be done this morning, I just wanted to, of course, I think probably the biggest obstacle is actually making that first step. Would you agree? Getting that first step, because there is that stigma about, quote unquote, needing to go to a psychiatrist. You know, as you were mentioning, you know, nobody wants to admit to that.
Yeah.
And sometimes it's not a bad thing that you want to admit to that if you need assistance, that help is available.
We want you to be comfortable, and that's why that first appointment is so important, and why we want to get to know people. And I want to stress again, personally, I don't like to use the word mental illness because, like I said before,
the stigma to it,
yeah, and I think we're guilty of chasing symptoms when we need to get to the causes of illness. So I think when people hear that, they'll understand that people are afraid of being approached as a mentally ill person, and that's not right, and we don't want to do that. We want to approach them from a system that has gone awry.
Exactly so. Now, if you want to find out more about the psychiatric services at Lamoille County Mental Health Services, of course, you can get a hold of David Mooney at the facility there on Harold Street. 888-5026 is the number to call, and they'll direct you to where you need to know. And of course, in general, of the other services Lamoille County Mental Health Services provides, of which psychiatry is just one, you can go to their website, which is lamoille.org to find out more. Now, next week, we're going to talk a little bit more about children, youth, and family services with some folks from Lamoille County Mental Health Services. And again, this is in recognition of Mental Health Awareness Month, this month of May. Dr. David Mooney with us this morning. Well, thanks, David, for coming in this morning, and all the best to you, and great work that you're doing, you and your staff.
Thank you, Roland. I enjoyed it.
Lamoille County Mental Health Services.
Thanks for giving us the opportunity.
Absolutely. We always enjoy supporting Lamoille County Mental Health Services.